The pandemic has hit a lot of people hard, but some groups have been particularly exposed. In the beginning at the Work Rights Center, our advisors' phones were ringing off the hook. People were just full of questions like, there's no work for me, how do I survive? Can I apply for furlough? When you've built your whole sense of self around your ability to work and to provide for your family, suddenly finding yourself without something to do, not to mention without income, really does something to your sense of self-esteem and to your well-being. Because no matter how hard people try, finding a job takes a lot of time. Take people on worker status, for instance. Unlike employees, workers don't have access to redundancy pay, and they also have very short notice periods. These are the 0 hours workers, agency workers. Another group that was hard hit was European migrants. From March to December, the Department for Work and Pensions stopped allocating national insurance numbers. So many people, many European migrants, have been unable to take up work. Universal credit has helped, and it's absolutely vital that we keep this lifeline. But there were still many issues of access. So imagine that you've just lost your job, you don't know how you're going to pay your expenses and cater for your family, you don't have a laptop, and you even struggle with English, but you suddenly have to master the power and the courage to tackle this quite long digital application. And next, we need to support people through their professional mobility. This means career advice, but it also means training. It means funding courses. It means realizing that we live in an age of continued education. I want to see a political agenda that puts people's welfare first. An agenda that understands that you cannot get people into jobs by threatening them with cuts to universal credit. An agenda that understands that you cannot have a productive economy by threatening people with precarious work contracts. We need to invest in people, in training them and in caring for them when they're vulnerable.